Senator from Utah.
Mr. President, as I listen to all of the discussion about health care, I've come to several conclusions. Number one, there is a 100% bipartisan agreement that something has to be done. But number two, there is a growing, strong bipartisan agreement that this bill is not the something that should be done. Just from the New York Times, I quote, it says, "The first big fight over the Senate Finance Committee's health care legislation erupted Tuesday night. A rollicking brawl over a deal that the Obama administration cut with the pharmaceutical industry to achieve $80 billion in saving in drug costs over 10 years, money that would help pay for the legislation. Top House Democrats have hated the deal from the get-go, and Senate Democrats are now bitterly divided." Close quote. This resonates with a comment that the Republican leader made where he says the only truly bipartisan thing about this bill is the opposition to it. I think this demonstrates that we need to slow down, start over, and do it right. Now, we've heard many speeches to saying we can't wait. We see people carrying signs, "Health care reform now." We've just heard from the senator from Nebraska that this bill will give us health care reform not now, 4 years from now. 4 years is a long time to wait. We can do it faster than 4 years, but we can do it faster only if we slow down here, start over, and do it right. We can do it in this Congress if we slow down, start over, and do it right. What are the things we need to start over on? The looming challenge in this whole thing is cost. The numbers are being thrown around, they're astronomical, and we still don't know exactly what they are. These are still estimates. The Senate Finance Committee has not reduced their proposal to legislative language. The CBO says we can't give it a score until we get legislative language, and by the time we get the language, it's at least 2 weeks before we can produce a score, and yet we're being told we must pass this bill next week. Slow down, start over, and do it right. Well, we're going to pay for it, we're being told, by taking $500 billion out of Medicare. And every study of Medicare says at least $500 billion is being wasted, so that's easy. Let's take $500 billion out and we'll solve the problem. Well, you can take $500 billion out of Medicare with a meat cleaver, and that means you're cutting the programs that are good in Medicare, the things about Medicare that work, as well as the things that don't work. Maybe we should slow down, start over, and do it right by taking the $500 billion out of Medicare with a surgeon's scalpel rather than a meat cleaver, and spend the time to find out where the money is being wasted, how it could be changed, where the incentives need to be altered so that the $500 billion comes out of the right part of Medicare instead of with a slash with a meat cleaver. And Medicare is not the only one where a more careful examination could produce significant savings. We're told that Medicaid in 2007 spent $30 billion improperly. If we extrapolate that over the 10-year period that we use to make these projections, that's $300 billion that could come from Medicaid. Are we going to take a meat cleaver to Medicaid and say we're going to arbitrarily cut $300 billion out of Medicaid in the next 10 years because there's a study that says that that much is being wasted? Or are we going to listen to the governors, bipartisan, Democrat as well as Republican, who are telling us what you're doing in this bill on Medicaid is going to bankrupt the states because they simply cannot sustain the kinds of increases that are built into it, and nothing will be done about the $30 billion of waste and abuse that's there. How are we going to get at it? How are we going to discover what that $30 billion is? How are we going to deal with it in a way that doesn't bankrupt the states? To answer that question, we need to slow down, start over, and get it right. Now, if I can be provincial and parochial for just a moment, my home state of Utah has done a great amount of work on health care. They've been very entrepreneurial and innovative. They've come up with ideas to deal with health care, ideas from which we at the federal level could learn a great deal. But we can't learn anything from the experimentation that's going on in the states if we continue this rush to an arbitrary deadline to get this thing done within a couple of weeks. The states have great experience with this. There's much the states can teach us. There's much the governors need to tell us before we rush to spend this much money, which means we should slow down, start over, and do it right. Now, as I talk to the businesses, as I talk to my constituents in Utah, I come back to the same thing I said at the beginning. There is a 100% bipartisan agreement that something has to be done. Our long-term challenges with health care are absolutely unsustainable, to use the Washington word. That's another word for disastrous. We have to deal with this, and we have to deal with it in an intelligent way, and the numbers are very large, and we have to recognize the stakes are very high. But that's, again, the message that comes from those who will be most affected by what we do, either in their businesses or their personal lives or their tax returns. It's very important that we get it right. And if we're going to get it right, we have to start over. And if we're going to start over, we have to slow down. That, Mr. President, is the wisdom that this body should adopt as it deals with this challenge, so that we can change the reality of where the bipartisan agreement is. Instead of the bipartisan agreement growing in opposition to the bill, we need a circumstance where bipartisan agreement will grow in support of a bill that will solve our problem. The bill before the Finance Committee is not that bill, and a large number of members of this body of both parties are increasingly coming to that conclusion. I yield the floor.